Empyema is one of many respiratory conditions, the symptoms of which may be similar to mesothelioma and/or pleural effusion. Indeed, it is a result of buildup of fluid between the lung surface and the pleural membrane itself, and therefore can result in the same type of chest pain and shortness of breath. It is, however, a different kind of affliction that is not necessarily related to carcinoma. Unlike pleural effusion, which is an excessive buildup of normal lymphatic fluids, empyema is the buildup of pus in the same space. This is an important distinction because unlike lymphatic fluid, pus is the byproduct of bacterial infections that is produced during the inflammatory response by the immune system. Pus is made up of a dead white blood cells and a protein fluid called liquor purus. When the immune system detects a harmful foreign or exogenous pathogen, it responds by moving blood plasma and infection-fighting white blood cells, technically known as leukocytes, to the affected tissues. This results in inflammation, which is the immune system's attempt to destroy the invader. Empyema is a result of this type of inflammation in response to a harmful exogenous pathogen in the pleural cavity. Most often, it is caused by pneumonia, but may also be a response to asbestosis. Because of the pressure, the lungs are unable to expand properly, which is why those suffering from the condition are often short of breath and experience chest pains. Patients with empyema often develop fever, chills, shakes, and/or malaise. Untreated empyema can result in septic shock. In addition to the symptoms which are common to many respiratory conditions, people suffering from empyema may also suffer from coughing, producing blood or greenish-brown sputum. Fatigue, dehydration, halitosis or bad breath, and unexplained weight loss are also symptoms. In some cases, victims develop a fever that may run as high as 105 degrees Fahrenheit. In extreme cases, patients fall into a coma. Empyema may ultimately kill the patient if not treated promptly. Because the bacteria that causes the infection is carried in the bloodstream, empyema can spread to all parts of the body. The pus may also build up to the point that a rupture occurs and pus enters the airways. In addition to pneumonia, empyema may also occur as a result of a chest wound, surgery, or a ruptured esophagus. Empyema goes through three major stages. The acute stage. This is the initial stage in which pus begins to accumulate inside the pleural cavity. This is also known as exudative stage, during which levels of glucose and pH remain normal. The middle stage. The pus starts to increase in viscosity, becoming fibrous. This is technically called the fibrinolytic stage, as fluids begin to coagulate and an adhesive network starts to form around the lungs. And the chronic stage. The lungs become calcified or encased in a thick, fibrous substance. Medical personnel refer to this as the organizing stage. If a preliminary examination indicates serious problems, or if there are signs of decreased respiratory function or abnormal rubbing sounds detected when listening through a stethoscope, if the patient has unexplained fever, the physician will order a chest x-ray and follow this up with thoracentesis, the insertion of a needle into the chest through which fluid can be extracted. The fluid will then be examined for pH and glucose levels, as well as the presence of infectious agents like bacteria. A computed tomography or CT scan may be ordered to confirm any findings up to that point. The first and most important step is to relieve pressure on the lungs by aspirating or draining the fluids out of the pleural cavity. Like thoracentesis, this involves the insertion of a tube in order to drain the pus away from the area. Since the cause of empyema is a bacterial infection, antibiotics are usually prescribed, particularly if the condition is still in the exudative stage. If the empyema has reached the organizing stage, surgical treatment may be necessary. This procedure is called decortication and consists of cutting and peeling away some part of the lung lining to relieve pressure and allow the lungs to expand normally. In normal cases of empyema due to bacterial infections, if the condition is treated in the early stages, prognosis is generally good. No permanent lung damage occurs. When the pleural lining has calcified, the lungs can no longer expand properly. While this is the third stage of empyema, it is also caused by asbestos exposure. It is important to understand that asbestos exposure by itself does not cause empyema. The topic is presented here because of unrelated parallels between empyema and various asbestos-related diseases. Mesothelioma, which is a carcinoma that spreads in a sheet-like manner rather than a lump, can also reduce the lung's ability to expand. However, technically this is not the same as calcification. Asbestosis, on the other hand, is known to be a cause of pleural calcification, although this is rare. These calcifications are typically small spots on the lungs, measuring under 4 centimeters in diameter. Talcosis, exposure to talc mixes, which is frequently contaminated with asbestos fibers, produces virtually identical results in a radiologic exam. Because of the parallel symptoms between empyema, asbestosis, and mesothelioma, it is important to get a second opinion if you have symptoms. Usually, a diagnosis of mesothelioma can only be confirmed beyond all doubt with a biopsy or sample of affected lung tissue. In asbestos lawsuits, a common defense is to deny that the plaintiff has mesothelioma or asbestosis at all, but something that only appears to be the said illness. In order to successfully win such a lawsuit, it is up to the plaintiff's advantage to have at least 2 concurring medical opinions and a pathologist's findings from a biopsy. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net, information and help for patients and families.